Hello everyone, welcome back to my channel. Yes, my dears, how are you? How are you doing? I hope you're doing fine. And those who are not so well, I'm sorry to hear that. I hope you recover soon. Yes, my dears. So today, my dears, I want to talk about something many immigrant nurses experience. Yes, coming from one healthcare world and working in a completely different one, like Sweden. Well, I never worked as a nurse in Uganda, but when I relocated, I came to understand and learn, even educate myself to something new. Yes, my dears, just completely a different system. So today's, topic or title is Uganda, versus Sweden. What does healthcare feel like? From two worlds. In Uganda, most of us grew up like seeing healthcare, it was busy, crowded, and full of life. Hospitals were like, families, stay by their, loved ones, bedside, relatives help with like feeding, bathing, and even buying medications. Yes, my dear, that's the order of the day. Yes, you can walk into a hospital and feel the energy, immediately. Yes, even if people are sick, but you feel that energy. With this, I mean like the noise, the movements, the people, everywhere, and even if I wasn't a nurse then, I saw, the dedication. People really tried, nurses tried, like running from, one patient to another, and, with limited resources, but working so much, they tried. Yes, some tried. I wouldn't say all of them, but many of them, they loved their job. Uganda, families like become part of the care. Yes, part of the team. Yes, community is everything. Yes, you don't go through sickness alone. No, my dears, you have the community, you have the family, around you. Friends, let's talk about arriving in Sweden. Yes, when I came to Sweden, it felt like stepping into a different world. Everything was calm, quiet, structured. The first time I visited like a Swedish hospital, I thought, oh, why so quiet? Where are all the people? Here the system does the work. The system does the work. Yes, and the structure carries the patient. Yes, not the family. Family is not needed. I mean, of course you have contact or that, but leave your loved one to the system, that's the nurses and the doctors, and they are going to care for your loved one. Yes, friends, let's talk about Sweden. Hemsjukvård, home nursing. Yes, working in hemsjukvård, hospitals and homes, or home care, it showed me this, a side of Swedish healthcare I didn't even know existed. Yes, my dears. You visit a patient in their home, you see their routines, you see their realities and their challenges. Yes, my friends. You take off your jacket. Yes, you take off your jacket to step into the living room, and suddenly it's not just medical care. No, my dear, it's human care. Yes. And what about in Uganda? In Uganda, families support the patient. Yes. In Sweden, professionals support the patient. Yes, especially in home care. Yes, my dears. Family, friends, What's the biggest difference? Yes. Let's start like with number one, the family role. Uganda, family is hands-on. Yes, they step in. And in Sweden, the system is hands-on. Yes, the system takes care of you. Yes. What about the environment, my dears? Uganda is lively, noisy, full of movement. Yes, in Sweden, it's quiet, controlled, and very organized. Yes, my dears. What about, like home care? Uganda, mostly family-based. Yes. In Sweden, is hemsjukvård or home care is professional. Medical care delivered at home. Yes, my dears. Yeah. What about, patient independence? Yes. Uganda is a family step in. Yes. And in Sweden, patients are encouraged to be independent. Yes. Like they say, like help, self-help, they help you to be independent. Yes. Now I have to talk about my personal reflection. Yes, my dears. Even though I never worked as a nurse in Uganda, coming from that environment, it shaped, how I see people and care. Yes. Uganda gave me community and Sweden gave me structure. Yes, my dears. And the hemsjukvården or hospitals in homes gave me purpose. Yes, my dears. Friends, thank you for watching. Yes. If you are a migrant nurse and living between two worlds or two cultures, the feeling of carrying like both worlds inside you, I can't relate. Yes, my dears. Yeah. It's, very, good and very important to carry, both worlds inside you. Yes. Please, thank you for this time. And don't forget to like, subscribe and share. See you, in the next video. Bye.